Your patients will love you for it, and you'll be a hero. Chiropractors work on the spine, and we want to get the spine to function at its best and be as pain-free as possible. That's how everybody likes to live life. One of the things that we tend to ignore is rehab. So chiropractors manipulate the spine, which is good. It's been shown that when you do that, in a previous video I talked about this, you stimulate the nervous system to actually make the brain function better, and it puts you in parasympathetic nervous system. But in getting the spine to be functioning without pain, you have to sometimes pay attention to the muscles. And the muscles require rehab, exercise. Let me just point out something that's really simple that we should all be aware of. You have different planes when you study in anatomy. You have the sagittal plane, you have the coronal plane, and you have the transverse plane. The sagittal plane is the plane we do most of our exercises in. When we're lifting weights, we're doing this, we're bench pressing, we're doing lat pulls, all in this plane. One of the things that you have to pay attention to is a muscle called the multifidus muscle. And they are very small muscles that run along the side of your spine, especially in the lumbar spine. And they're there to stabilize the spine. And you cannot exercise those muscles unless you're exercising in the coronal plane, which means you have to do exercises that cause you to go out to the side. This is overlooked a lot of times. People go to the gym, they get in shape. You see these big bodybuilders come in and they have back pain and they don't know why. A lot of times it's because they don't do anything in this direction. A good thing you do with the patient is have a catch with them. When they catch that ball, they got to reach out into that plane and it's going to strengthen that muscle. Or you could do something called a bird dog exercise where you're on all fours and you're raising up alternate arms and legs. There are ways to build up to that. So when you do exercise with a patient, do it on a gradient. Don't start with the hardest exercise first. First of all, your patient will hate you for that because they'll be in so much pain the next day, they're going to not come back. So you start on a gradient. You do easy exercises because sometimes these muscles are very small and you need very little work, but it has to be focused on the muscle. So have them do a bird dog laying on the ground with a pillow underneath, and that's easier, and you can build up to that. Then, if they get better, you can put a ball underneath them, a big Swiss ball, where they're actually doing the bird dog exercise there. And then if they're still able to do it, then have them do the bird dog without the ball. And then finally, as a final gradient, you could have them do what's called a Superman, where they're laying on their stomach and they're raising up their arms and their legs. And this is going to all strengthen the lateral stability of those muscles called the multifidi. Your patients will love you for it, and you'll be a hero, and they'll be able to get back to life and do the things they love to do because now they have stability in the muscles where they didn't have it before.